Ladies and gentlemen, a warm welcome to all at the PCQuest HealthTech Forum. COVID showed the true light where we are in terms of medical infrastructure, preparedness for the future. But one thing I must say, COVID has also opened the doors of opportunities for all, where technology took the center stage and marvelous interventions are taking place at a rapid pace. Today at PCQuest Health Tech Forum, eminent leaders and professionals will share their valuable insights and also emphasize on how technology should be revamped and made to good use for humankind. I would like to thank our presenting partners first, Dell Technologies, digital transformation partner Accenture, academia partner APG Education, and knowledge partner CIOL. At the very beginning, I would like to invite Mr. Pradeep Gupta, Chairman, Cyber Media Group, to start the PCQ Health Tech Forum with his opening remarks. Pradeep Gupta is the chairman of the Cyber Media Group, the specialty media house with brands like DataQuest, PCQuest, Voice and Data, Dare, CIOL, Global Services, etc. Pradeep was conferred the National Entrepreneurship Award as the best mentor by the Ministry of Skill Development and Entrepreneurship, Government of India. He is the chief mentor of Electropreneur Park, Delhi and Bhubaneswar. He is also an angel investor and has mentored over 250 startups, co-founder of the Indian Angel Network, Asia's largest angel network. Pradeep was also a global trustee of TIE, the world's largest entrepreneurial ecosystem. He chairs the IIT Alumni Trust, Ivy Cap Ventures. Pradeep was also the GP of India's first angel fund, Infinity Ventures. He was on the board of UTI AMC. He has been the past president of Pan IIT India and Association of Indian Magazines. He has been on the boards of IIT Mandi, Indian Newspaper Society, IIT Delhi Incubator, IIM Calcutta Innovation Park, and Lemon Tree Hotels. He is the recipient of the Distinguished Alumni Award of IIT Delhi and IIM Calcutta and the Helen Keller Award for working in the disability sector. Pradeep is an engineer from IIT Delhi and an MBA from IIM Calcutta. Over to you, Mr. Gupta.
Good morning, ladies and gentlemen. I welcome you to this much needed discussion that we are going to have today on health tech. Health tech has really come to the fore in the last couple of years. The pandemic, as we all know, accelerated a few things. And the most important thing was that it moved technology into the center stage. A lot of things where we had these blockages in our mind, essentially changed that mindset. And we immediately started looking at various kind of remote solutions, solutions that required social distancing and so on, contactless interaction and so on. And perhaps it was the tech sector, the medical sector that got impacted the maximum because of what happened in the last 2 years. Let's look at the different ways in which this has happened. Look at the way the government rolled out the entire program in terms of whether it was contact tracing initially, then after that the vaccines and linking your vaccination to various kind of things and so on. If we start looking at devices, so many different kind of devices suddenly started coming up because of the use of technology. In the last 2 years, we have witnessed a lot of UV-based products for cleansing. Like that, we've had devices coming out for all varieties of tests to be carried out at home. I'm not saying that these devices were not there, but suddenly they started becoming so very important in our life and started getting adopted by each and every person. Let's also look at the other part of the entire health ecosystem. Look at the hospitals. The way the entire hospital ecosystems started moving into technologies, right from, to ensure contactless interaction. You had robots at the reception. You had ways and means by which tests could be done in a contactless manner. Then in terms of handling the crisis, use of digital technologies for handling different kind of pressure points which are coming. The hospital ecosystem also revitalized itself and moved to a completely different kind of a plane. Look at the entire area of distribution. Everything moved online. You had suddenly various varieties of online pharmacies coming up where you could be delivered medicines anytime, anywhere. That entire ecosystem, the way it has got accelerated in the last 2 years, is absolutely phenomenal. Furthermore, if you look at the logistics, in remote areas, the use of drones, the use of the UAVs for spraying disinfectants and so on. That entire part of the ecosystem also changed accordingly. If we look at the way this digital transformation in the health sector has happened in the last 2 years, I have no hesitancy in saying that we can actually treat the advent of COVID, we can treat 2020 as a break in the entire cycle of health tech. That suddenly, from where we were to where we went, there was a massive leap that happened. And I think, we have constructed today's program, today's sessions to discuss what are some of these changes that have happened. And not just that, we are also going to be looking at what is the future going to be. Because if you start looking at the future, you will now find more and more technology coming into the health sector. You are going to look at telemedicine has been around for years, right? But you will now start seeing telemedicine moving center stage, moving and becoming very important part of our lives. Deep tech, perhaps robots, a robo-doc is probably still a few decades away, but robot-assisted stuff will start happening soon enough. We are also looking at this health stack. The government of India has put together health as a mission and is putting together deep technology behind that entire thing to ensure that there is seamless transfer of data, the health data across various, whether it is the doctors or the nurses or the pharmacists or the test labs and so on. So, there is a complete revolution that is taking place in this sector, which in the next 5 to 10 years. And we will be deliberating on some of these changes as well. So, sit back and enjoy the deliberations that are going to take place today. We have an absolutely fascinating lineup of speakers for you. We have people from the government, from the medical community. We have the startups. We have different variety of people who will be talking about what this new world of health tech is going to be. With that, once again, I welcome you on behalf of Cyber Media. Thank you very much for attending to today's session, and I hope you gain a lot out of today's deliberations. Thank you very much.
Thank you, Mr. Gupta, for those encouraging words. I would like to now invite Professor Randeep Guleria, Director AIIMS, New Delhi, for a very special address. Professor Guleria has done pioneering work in respiratory medicine and has several awards and honors to his credit. He is the first Indian to get a Directorate of Medicine in Pulmonary and Critical Care Medicine and was conferred with the prestigious Padma Shri Award in 2015. He is also a member of many key committees in the Government of India, including the Joint Monitoring Committee to monitor outbreaks of new diseases.
First of all, let me really thank PCQuest HealthTech for inviting me as a key speaker. I'm really delighted to be here. I think the topic that they have and the discussion that we're having today are very, very relevant, especially because of the pandemic and the lessons that we've learned during the pandemic. I think when we had the pandemic, when we start looking at healthcare and technology, we were really lagging behind as far as technology was concerned in healthcare. And that was because of multiple factors, predominantly a reluctance by health professionals to really adopt technology and change their ways, as has happened in many industries across the board. But I think all of that changed in the COVID era. And therefore, a lot of changes happened during the COVID, which really pushed the frontiers as far as health technology or technology in healthcare was concerned. First of all, because of the lockdown and the challenges that we had because of the lockdown, teleconsultation became something which was very, very important because patients could not really come to the OPD because of the fear of getting COVID. The lockdown had restrictions itself. And secondly, people with COVID did not know how to really reach out and find out the do's and don'ts in terms of management. And therefore, in March 2020, the government came out with the telemedicine guidelines, which actually had a framework and in a way legalized teleconsultation so that people could really get teleconsultations in a proper format. I think that was a huge step. And to take it forward, the government actually started the e-Sanjeevani program, which is also promoting teleconsultations across the country. And this is also doing very well. Digital health and technology was already there to some extent in healthcare. Ayushman Bharat is one example where technology has been used to provide care to a large number of Indians and who need in-hospital care. But I think along with that, we realized the importance of technology, and this actually led to a lot of advantages that we were able to really build in. One was when we had the huge surge of cases in the pandemic, using technology, one was able to really reach out to various hospitals. We at AIM started what we call e-ICUs, and we interacted with hospitals across the country. I myself probably have interacted with more than 550 hospitals, talked to doctors there, discussed management of COVID in ICU and sick patients, and came out with proper guidelines, support, and advice to people. And this led to the concept that we could even use this subsequently in the form of doctors who are present in one place being able to advise physicians who are not specialists in that area. You may not be a critical care specialist, but if you have a sick patient in an ICU, by using an e-ICU concept, you can see the patient's parameters, you can see the patient's virtually, you can see what are the drugs that the patient is getting, and be able to give comprehensive advice in terms of patient management without being physically present there. And by this way, specialists who are present in limited numbers could really advise a huge number of patients or hospitals as far as patient care was concerned. So I think this was a big step, and this became something which was acceptable and would really be useful even in the post-COVID era. Similarly, the use of artificial intelligence, neural network became very, very useful for people to really manage patients and to see how they could really start looking at various ways of being able to predict whether a person has COVID or not, or whether this is going to go into more severe illness, and how this could be taken to a next level in other illnesses also. I think this has a lot of advantages. We also then had this promotion by the government of the digital health mission, which in my mind can be a game changer because this will allow everyone's digital health to be literally carried like an Aadhaar card. And this, if we can really get all the private sector and the public sector on board, then no matter where the patient goes, to the private sector, to the public sector, his health records will go with him, and therefore this will really avoid duplication And as we move towards more and more non-communicable diseases in our country, diabetes, hypertension, stroke, chronic respiratory diseases, the digital health record becomes very important because you have these diseases which are there for life. A diabetic has diabetes for life. A patient with hypertension has hypertension for life. And you need monitoring and close observation so that complications don't happen because of these diseases. Don't want person to develop diabetic retinopathy or diabetic nephropathy leading to chronic kidney disease and dialysis and transplant, or heart failure or stroke happening because of uncontrolled hypertension. So I think the digital health mission and this will really take things to a new level. Also, this technology can be used using artificial intelligence to be able to see whether we can use telehealth. Can we use devices like Fitbits, which patients have, and they can actually monitor patients remotely and using artificial intelligence and algorithms, be able to predict an event before it happens. You have a person whose heart rate suddenly starts going up, his saturation starts falling, or there is some irregularity noticed in the ECG. Could that predict that this person is going on to an acute event? And therefore, an alert could be sent to the patient, to the doctor, even to the nearby hospital. And thereby, you could actually save lives and it could be very useful. I think this is the next level that we need to really go forward. And there has to be training of the workforce, in my mind, if all of this gets adopted. One of the reasons why uh, we were not able to have transformation in healthcare as far as technology was concerned is because we need to get everyone on board, especially the users. And I feel that whenever we have technology coming in, it has to be user friendly. So doctors who are going to really feed that data in, who are going to use this, have to be comfortable with it. Other healthcare workers, even whether it's an ASHA worker, has to be comfortable with the technology that we're trying to use, and they should be able to accept it, and it should be user friendly. At the same time, this technology could really help allied professionals who may not be healthcare professionals per se, help the system in providing care to patients who are in rural India and remote areas where healthcare is not up to the standard. And by this, we could actually improve healthcare in that area. So I think there is a lot that can be done as far as health and health technology is concerned. And therefore, I think we are in a position where we need to push it forward. COVID has taught us a lot as far as the utility of health technology is concerned. I just hope that we're able to sustain it as we move away and start seeing COVID becoming from a pandemic to an endemic disease. The lessons that we've learned during the pandemic of the power of technology in healthcare should get translated to long-term sustainable solutions that our country needs in terms of healthcare in remote areas, in rural areas, so that there's equity in healthcare. Currently, there is a lot of imbalance as far as healthcare is concerned in, let's say, secondary and tertiary cities as compared to smaller towns and in rural India. That inequity we need to correct, and we need to develop a mechanism that healthcare is there irrespective of socioeconomic status. No matter what be your status, you are provided good healthcare so that quality of life is good, and at the same time, the workforce remains healthy. So we focus also on preventive health. In our country, the focus, I think, also has to be a lot on preventive health, and health technology can really help in educating people, in making sure that preventive health steps are there, and for early diagnosis. In rural India, people don't get their blood pressure checked until they have a stroke. They don't get their blood sugar checked. So if we were to use technology to be able to do this so that we are able to screen patients, whether it be for chronic diseases or even for cancers, 60 to 70% of cancers are preventable. And many cancers, if detected early, are curable. But unfortunately, in our country, most cancers come in a late stage because of the fact that we haven't really focused a lot on preventive and early diagnosis. So I think that is where technology can really make a huge difference. And and I really would congratulate the PCQuest HealthTech meeting that is being held here. And I am sure that this will really go a long way in getting people to brainstorm and find solutions which are sustainable and could really be a game changer as far as healthcare in our country is concerned. Thank you very much.
Thank you, Professor Guleria. Now I would like to call upon for the industry keynote, Ms. Sathya K, Regional Sales Manager, Education and Healthcare, Dell Technologies.
Hi all, good morning and thanks for having me here in this event led by Cyber Media and PCQuest on the theme that's making headlines, transformation in healthcare. Building human progress has been Dell's purpose, and with the pandemic, is there a better time than now? As I'm here, some of the leaders and among the leaders and veterans in the healthcare industry and innovative solution providers who stood up to the occasion, I would like to recall and thank them all for facing the crisis and the biggest IT challenge in keeping up with the demands. Your teams rose to the challenge and accomplished what just a few short months ago seemed impossible. As we move forward, if there is one question that every IT organization is asking, it's, are we ready for whatever comes next? When our company announced our 2030 social impact vision and moonshot goals in 2019, healthcare was front and center. Our founder, Michael Dell, announced we are looking at touching 1 billion lives by 2030. I'm very excited to see the role of Dell Technologies in going to play in healthcare as we team up with healthcare customers and partners such as yourselves. Our ability to impact healthcare trends and further complicated given we are in the middle of a data and technology explosion that is disrupting the healthcare industry. Healthcare is personal for all of us now. Healthcare is at the forefront and plays a central role in Dell's strategy. We can help you accelerate your transformation journey no matter where you are based on your own initiatives and budget. Over the next 8 years, we see that the data will zoom up such that we will become a planet with 163 zettabytes of data produced per year, connecting 8 billion people, 75 billion devices every 18 seconds. According to Forbes, up to 20% of the data will be critical to our lives, and the amount of data under healthcare organizations' control is skyrocketing, marking just the beginning of an exponential increase in patient health data. At Dell Technologies, we know that every organization's digital transformation journey is unique. We are getting closer to our customers by developing, co-working, and customizing solutions that best fit each organization's ecosystem. Our healthcare practice has domain experts and doctors as part of our strategy team, and they offer us the consultation, domain strategies, roadmap, and GTM guidance. Isn't that a great news? We work with customers of all scale, be it emerging, mid-size, or large scale, and of the healthcare categories like hospitals, pharma, healthcare, health tech, and more. We combine industry-leading capabilities, global expertise, best practices, and our ISV capabilities to deliver jointly engineered, tested, certified, and pre-integrated solutions that provide the highest level of performance, availability, security, and automation to best meet your application workload requirements. Dell Technologies is not just award-winning PC server and storage organization. Allow me to explain what Dell Technologies looks like today. We have an unmatched capability of technologies and services. We enable the multi-cloud world, software defining everything with VMware and Virtual Stream. We help customers transform, automate, and modernize their data centers with our Dell EMC infrastructure solutions and VMware. We enable workforce transformation with Dell Client Solutions, and we surround all of this with intelligent business-driven security from SecureWorks. At Dell Technologies, we offer pragmatic innovation and addresses healthcare's toughest challenges. Our framework or pillars that we are driving based on industry trends are modernized technology, connected workforce, virtual health, and personalized health. What do we do on technology modernization is something interesting you would be interested to know. We provide multi-cloud solutions. To take full advantage of cloud offerings, IT departments must first assess their workloads and applications to determine the best cloud model for each. They must also develop a greater understanding of where data is coming from and going to in order to achieve flexibility and deliver a seamless experience to providers and patients. We are partnering with some of the market-leading data centers and also providing as a service model for enabling our customers in building and refreshing their data center infrastructure. Next is our focus on health IT infrastructure. To propel your digital transformation, make sure your IT platforms are digital ready. When information is unlocked, it connects the healthcare experts in a healthcare community. It ensures that they have access to all available relevant patient information and speeds up healthcare delivery and increases potential patient satisfaction, compliance, and outcomes. To enable this, providers need the flexibility to turn traditional on-premise infrastructure into a private cloud and to operate across multi-cloud environments. A consistent infrastructure reduces infrastructure cost by 18% and security breaches or outages by 30%, according to a research conducted on behalf of Dell Technologies, VMware, and Intel. The third point under our discussion is high-value workloads that are key for applications like EMR and medical imaging. Workload optimization focuses around driving higher efficiency, availability, and performance for key ISV applications. This incorporates modern flash-based technology, advanced replication and availability services, and leveraging virtualization to drive a consistent set of tools across the application environment. For example, our Epic customers running on Extreme IO and VMAX All Flash have seen huge improvements in response time of the application. This makes the doctors and nurses' day more efficient as they are not waiting for data to update. The second pillar in our framework is connected workspace. We create healthcare digital workspace by simply and securely delivering and managing any application on any device with VMware Workspace ONE, an intelligent-driven digital workspace platform. Workspace ONE integrates access control, application management, and multi-platform endpoint management into a single platform and is available as a cloud service or on-premise deployment. VMware and Workspace ONE is integrated into all Dell and user devices, enabling IT providers in healthcare organizations to achieve more with easier management of all endpoint devices. We focus on remote imaging and diagnostics. With rapidly changing work environments and the need for a more flexible workforce, healthcare is now implementing new revenue streams that accommodate with these new modalities. Remote imaging and diagnostics can now be enabled with modern infrastructure and modern end-user technologies that have the capacity to transfer large data sets fast with high quality and security so that new digitalized patient information and diagnostic results can be accessed and analyzed by care providers independent of their location. Third point of a connected workspace is end-user trusted devices, access, and data. Empower your staff with secure on-demand solutions from device to the cloud. The way you care for patients is changing, and we are adapting our solutions to support you. By building flexible end-to-end solutions into your organizations today, your team can seamlessly adapt to a world that is constantly redefining. From remote patient care to tele-ICUs and AI-assisted workflows, which virtual healthcare solutions provide the opportunity for healthcare organizations to rethink their delivery protocols and workflows, which lead to our third pillar of framework, virtual health. There's never been a better time to embrace the fast developing benefits of virtual health. From increased access to care, improved patient outcomes, and increasing access to reimbursement and reducing overall cost of care, innovative remote care solutions are radically and permanently changing how our healthcare is delivered to achieve clinical and business ability to as we shift from response to recovery. Telehealth is playing an important role. Patients and providers are adopting telehealth as it becomes mainstream. Patients and their families value their flexibility to communicate with care providers at a time that is convenient from the comfort of their own home. As providers evolve telehealth services, they must continue to improve interoperability across the care gamut to gain a complete picture of the patient from all sources, EMR, AI, IoT devices, direct patient input, and more, whether the patient is chronically ill or seeking wellness guidance. Next is remote patient monitoring. Readmission cost per bed and patient management costs continue to rise over the time. Remote patient monitoring and virtual care technologies are helping hospitals lower readmissions through new preventive measures that allow analytics platforms powered by Dell Technologies to unlock your data for remote consultation and predictive medicine. The last pillar of our framework is personalized health solutions. We provide solutions for precision diagnostics. Enabling data for analysis and predictive analytics tools leads to potential new way to treat each patient's disease in unique and innovative ways. These technologies are enabling the ideas of personalized medicine into the realm of reality. For researchers, genomics, and life sciences organizations, our approach to precision diagnostics is unique, and it gains from our experience in other industries, but looks for close partnerships to create reliable, secure, flexible, and robust technology solutions tailored to their specific needs. Dell EMC Ready Solutions for HPC tailored for clinical genomics helps customers to get the optimal IT infrastructure for today and tomorrow. That means creating solutions with scalable building blocks optimized to meet the needs of specialized clinical applications. Dell EMC Ready solutions for HPC are built on modular blocks that can be configured and ordered in a simplified process that enables you to scale easily to meet new capacity and performance demands. Dell EMC's extensive track record with server storage, networking, and service enables us to implement holistic solutions that work from day one with an eye towards the future. Last in our discussion today is digital pathology. As pathology workflows digitalize and care specialists leverages new technologies like AI and ML, new patterns and correlations are formed, which can lead to innovative care solutions. This digitalization process is underway, and modern IT infrastructure with access to multi-cloud digital infrastructure will help empower clinical teams with agile platforms, secure access, and expanded data interoperability to take advantage of this newly digitalized data. With booming industry solutions, data explosions, and health consciousness, healthcare is dear to us, and we are aligning with current trends and demands. I drive the charter for this key vertical for Dell India and would be happy to connect with you on your thoughts and any initiative that you are driving towards patient care, improved patient experience, faster access to key data that would make your service better and your vision towards serving humanity. Let's work together, and thank you for your time.
Thank you, Ms. Sathya, for that overview.